So, step number one, when I have a patient that comes to see me specifically for low back pain, is we need to understand the crime scene before we start moving things around. Now, that's kind of a weird analogy, but when you walk into a room that has just had a crime committed in it, very rarely is the investigator or the policeman going to say, let's move these things around and let's look here before we have a big full picture of what's going on. So I'll take my patient very consistently. I'll take my patient who just comes in, and the first thing we'll do is we'll take an x-ray of their low back. We'll look at it from the front, we'll look at it from the side, we'll do other views if necessary to see what the nature of their problem is, what's the cause of the pain that they're feeling. Oftentimes we'll get a really great objective view of where we're starting from, and then from there, moving forward treatment-wise, depends on what we find objectively on an x-ray. And on top of that, we go through a very thorough exam of what they're feeling symptomatically, and we'll put them through what are called orthopedic tests to provoke different types of pain, other types of symptoms that might arise to understand more about what their problem truly is. Every single patient that comes into this office for low back pain and otherwise, once Dr. Hill and I have discovered the problem, the next step is to teach our patients what we've found, to sit them down one-on-one, to look at their pictures with us, and to walk them through the understanding of why they feel the way that they do. It's great that we know it, right? But it's even more powerful if we can impart that wisdom to our patients, not just in a way that helps them understand why they need us, but in a way that helps them understand how they can become independent over the long haul. So after that learning process has happened, we will, of course, help them in any way that is prudent for them, whether that's treatment here in our office or giving them stretches or rehab or exercises that they can be working on at home, or even taking it a step further and understanding that we may not be the best option for them. They may need other means to start their process before they can come in to see us. Whatever is what the patient needs is what happens here in this office.
When we take in and treat a patient, there's no two patients that ever get treated the exact same way. And there's no two patients that I've ever seen that ever started having a problem the same way either. When we start adjusting or treating a patient, some people may get adjusted every day for a week, and some people may get adjusted on a different schedule, but it's based on what the patients need and what they can tolerate. It's based on what every patient needs to end up in an independent way. And I have this thing in my office that we kind of attest to this, that we give all of our patients exercises. That's part of the protocol of getting well and getting treated. And if the patient doesn't do the exercises, if they refuse to do it, then we'll fire the patient, because we don't want anybody paying us not to get well. It doesn't do any good to come in. In fact, that's why we have them, as Dr. Hill said, go through a report of findings and understand what the crime scene is. If they don't understand that, or if they don't want to listen to it, then we really don't want them as a patient. We won't treat everybody. We want the ones that want to get well, and we do a really good job at concluding care, creating independence, and then walking with them the rest of their life to stay well. Just like a dentist would. You might go see a dentist every 6 months. Well, my patients come and see, we have them come in every 6 months or so based on what their need is. And then we check to see how well they did with what we gave them. That way we're never going back into crisis mode. And so chiropractic care is different for everybody, but it's very effective when it's done in the right way. When a person gets a chiropractic adjustment, normally you would hear some noise. A lot of people get all wigged out about, there's a little bit of noise or what happened. And they watch a lot of movies on TV where, you know, somebody walks up and grabs the guy's head and turns it, and they fall down and they're on the floor. The noise that you hear, it all starts with when muscles shorten up, they take and move bones. Muscles shorten by using them, and muscles shorten by being injured. When the muscles shorten up and it moves the bone into a position that's malposition, that's called a subluxation. That subluxation typically will put pressure or create irritation and soreness in that area, or dysfunction. Somebody might fall asleep and sleep on their stomach and turn their head, and then they wake up and it doesn't straighten out, and they come in like this. Well, our job is to say, why doesn't it straighten out? First thing we have to do is we have to evaluate it, and then after doing a really thorough evaluation, we will take and lay the patient down. We have already assessed the area based on x-ray. We'll take our hands on that area, and we'll take the bone that is sitting in a malposition, and we'll take and move it into a position that's correct. Now, does that hurt? Most of the time it doesn't, because the body knows that that's normal. You know, if you moved it in the wrong position, then it wouldn't feel very good. I tell people that in bodies you have ligaments that hold bones. Ligaments are structures that go over joints, and they limit the ability of the bone to move. Like, I have a ligament on this side of my finger, so I can't bend my finger that way, but I don't have one here. Well, a good chiropractic adjustment would never move a joint in a position that it is not supposed to move. You know, that's why we go to school and we know what we do. So when we take and move a bone, our job is to take and move it away so the joint opens up. The noise that you hear typically is a fixation. Fixation is caused by fibrin. Fibrin is brought in by the bloodstream. There's a cell called a fibroblast. That when you end up having pain, that body has to heal it, so it brings blood into that area, and it lays down like a scab over the area. That's called fibrin. In fact, all your scars are fibrin. And when you have that fibrin that gets deposited over that joint, then it creates a limitation of being able to move, on top of the fact that the brain doesn't want it to move because it might hurt the nerve. Our job is to take and move it in a way that decompresses the nerve so the brain doesn't guard it, and then to take and give a gentle thrust through the joint to open up the joint, to mobilize it again so it's adaptable. Once it's adaptable, then the body will self-regulate, and it will become and hold it in a position that's normal, because now it's out of crisis. So that's pretty much what a chiropractic adjustment really does.
And in specific relation to low back pain, we know that the lumbar spine, the low back, has 5 vertebrae in total. 5 of them stacked on top of each other, with what's called a sacrum at the bottom. In between each of those vertebrae are joints that need to move independently of each other to maintain function of the overall back. If you think about the way that your hand is able to function, you have 5 movable fingers to do dynamic things like pick things up or throw things. If you were to lose the function of one of your fingers, it hinders the overall function of your hand, and you have to change the way that that dynamically does things from that point forward until you deal with the underlying problem. So a lot of people that are struggling with low back pain, we have to remember that the way that joints stay healthy is to move. If we don't move them, if a couple of them in the low back are not mobile, overall the back isn't going to function at its optimal state. So a chiropractor, what we would do to focus on that is to help those immobile joints to regain mobility so the overall function returns. And most of the time, the pain that originally was there will dissipate as that happens.
Yeah, that mobility too, since all spinal joints are synovial, what that means is that when they move, they produce an oil, or they self-lubricate themselves. And if you have a joint that can't move, then it's a dry joint and it's painful. If you set it free, it starts moving and it starts lubricating itself. And when it does that, then it becomes healthy again. So it's very important to maintain mobility in all those segments. People who are sedentary get stiff and they hurt. People who move, people in motion are the healthiest people.
So one of the many ways that we lose function in the low back is because muscles have either been damaged or been in repetitive usage patterns that cause them to shorten. As stated earlier, when muscles shorten, it restricts the ability of the whole spine to function, to move the way that it should or can. So what we do here in our office during a treatment process, of course, but also giving our patients homework, stretches, exercises that they can do at home, is to focus on those, to make sure that they're addressing not just mobility of joints in isolation here through adjustments, but that they're on a daily basis doing specific stretches that pertain to the tight muscles that they're dealing with as individuals. Just like brushing your teeth every day, if you don't do it every day, you slowly get tooth decay in your mouth. If you don't do stretches every day, you lose the full function of what potentially could be there in your lower back or anywhere in your body.
Yeah, it's pretty interesting when you look at the animal kingdom, there's not an animal that I know of that doesn't get up and stretch. Cats stretch, dogs stretch, birds stretch. I have a parrot that every day, will take and stretch his wings. When you stretch a muscle, that produces movement in the joint. The people are very routinized. People who put ceilings in or a roof or put down tile on floor, they all do the same thing every day based on their job. You develop muscle systems based on what you do. As you do those things, the routinization that you have, like a good example would be, a mother has a baby and she is right-handed. Now, after the mother has the baby come out and she's holding the baby, mothers who are right-handed always hold their babies in their left arm. And when they do that, then they have to take and lean to the right to hold the baby up. Now, if you do that for 9 months or 12 months as you have that Klingon on your hip, the muscles on the right side of your back are holding that baby up, which means they're working harder on one side than the other side. By the end of the day, muscles shorten up just like teeth get plaque on them. And muscles never lengthen themselves. I've never seen a muscle lengthen itself. It just doesn't do it. That's why all athletes stretch. And so if you have a repetitive lifestyle and you have muscles shorten up and muscles are going over bone structures that have nerve endings in the joints and nerves coming out of in between the bones, then if you allow that muscle system to take and shorten up, it will take and start making the nervous system start to scream. And as it does that, it starts to whine in different areas. That whining then is picked up by the brain, and the brain, it's a self-protecting organism. It's going to take and do everything it can to try to protect it. If you took and eliminated that shortening that the mother had by holding the baby, by teaching her how to stretch those muscles that she just used at the end of the day, then she gets to go to bed and she's not going to bed with like we would say dirty teeth. She's cleaned them off. If she stretches in the morning, then now she's prepared herself for doing the day's work, because during the day they're going to shorten again. They shorten every day. And so if you take and lengthen the muscles in the morning and lengthen the muscles in the evening based on what you do, you won't have the muscles shorten and you won't have compression. You'll stop the joints from becoming arthritic, and you won't have chronic pain or whining the body has every day that you're going to take an Advil or have to stop something. It maintains function, and it makes all the joints continue to produce good synovial fluids so they don't rub, dry out, and destroy themselves. So stretching is critical. It's a number one thing in this office. You have to stretch. Can't get well if you don't do it.